Good afternoon to all my friends in Oldish land. How are you? I'm so glad that you've been able to join us today. It's a beautiful day here in southwestern Ontario. Yesterday was even more beautiful. I had my sheets out on the line. Love that time of year, but we're supposed to get some more snow on Thursday, so it's not over yet. It's not over, but it will. It'll come. Anyway, my name is Karen Brown. I'm the publisher and editor of The Oldish. And as I said, I'm very glad to have you here with us this week. We're going to take a look on this show at the articles that we've published in The Oldish this week. We're going to take a look at a really cool gift as Mother's Day and Father's Day are coming on for you to consider for a loved one who may be experiencing some mild dementia but is aging in place, just to support their independence a little bit. We're going to take a look at some really interesting federal Canadian health news, and then we're going to look at what's coming up on shows in the future. So let's get started. This week on The Oldish, we published a great group of articles, as always. Shout out to our main author, Heather Meir. There was an article on help for caregivers who suffer abuse. So I'm not talking here about, on the street being bullied by kids or an employer. I'm talking about a caregiver who suffers abuse at the hands of the person to whom they are providing care. It happens a great deal, and it's a very isolating experience. It's not the person, it's the disease. You hear that a lot. And while it's true, that doesn't really help when you feel so alone. So read this article and check out the resources that are available for you. There is a really interesting housing pilot being built out in BC. Now, as we age and we get to a point where it's difficult to manage on our own any longer, we have two choices. We can move into a long-term care facility, or we can move in with one of our adult children or have them responsible for supervising us in our home. There's really nothing in the middle. It's you're all in or you're all out. But this pilot that is being built is one of a few in the world that is being built as an intergenerational pilot to look at senior housing in a different way. So the only proviso for this housing unit, and there are rentals as well as condos, is that someone in the family unit has to be over the age of 55. So imagine your whole family, mom, dad, you have careers, maybe you have children who are in high school or college, and you want your aging mother to come and live with you, but she needs help and you're a little afraid to leave her alone. This housing project may be just the thing for you. Mom is going to be over 55. You're going to move into this as a family unit. Mom and dad still get to go to work. The mother, the aging mother, can stay in the house, and through the administration of this housing development, you can purchase the services that you need from a menu of things. And as mom's need changes, you can drop off one service and bring on another. It's really a very interesting pilot project. Now, it is private sector, so it's not going to be something that everybody's wallet can afford. But it is a really interesting step into the world of the private sector looking at how they can bridge the gap between retirement homes or living with aging children. I mean, by the time children are looking after their parents, they're aging themselves, right? And they have their own lives to lead, and maybe they can or maybe they can't afford the time away from work to look after an aging relative, but what choice is there? So now there's more choice. It's a really interesting article, and take a look at that. There was a good article for people who like to count calories. Do you count calories? I hate counting calories, but I confess I do look to see if something has a high calorie intake or not. So a study has recently been produced that shows that people who count calories aren't necessarily the ones that are going to enjoy weight loss and be able to sustain it. Instead, the people who reduced their sugar and refined grains and processed foods in this study were more likely to lose weight and then maintain that healthy weight. That sounds like a lot better kind of diet to me. Anyway, take a look at that and see maybe your days of counting calories are out the window. It would be good. Have you ever thought about going back to school as a senior? I remember when I was in university, I went to Trent University, and I was an adult student. So I had worked for a few years, and then I went back to university. And there was a woman in my summer school class who was 65. Her name was Olive, if I recall it correctly. And she was a student in the summer program. She would stay for 6 weeks and pick up 2 courses and do that every summer. And she was getting her degree. There was a program at Trent at that time. I don't know that it's the case now, but it is the case at many universities across Canada and indeed across the world, where aging seniors, you have to be a certain age, 60, 65, can get their tuition for free or at a vastly reduced cost. Olive got hers for free. So Olive got her degree, and darn it, she graduated with a degree that she wishes had been an option for her when she was a younger woman, but it simply wasn't. So I got my degree too many years ago to want to tell you, probably 35 years ago. So I'm sure Olive is no longer with us, but at the time she was 65. And, when she was a young woman, there were much fewer options available to women. You were a teacher, you were a nurse, or you were a housewife. And I believe she took the housewife path, but she went back to school and got her degree. So go Olive. And for all of you who are thinking that you might like to go back and grab some higher education, now might be the time to consider that. Okay, I want to show you a really interesting product that we've discovered. For those of you who watch The Dragon's Den, for our American viewers, Shark Tank is the American version of The Dragon's Den. Entrepreneurs come on and they hope to get some money to push their product to the next level, get it out there for people. This woman came on with a product that was intended for young children. Think primary school. And it was called Easy Daisies. And it was a board that had a tree on it, and their chores were on one side, the to-do chores. And once they had done the chore, they moved a little magnetic chore card from one side of the tree to the other side of the tree to indicate that they had completed that chore. Well, it wasn't very long before the people at Easy Daisies realized that there was an application for aging seniors who had mild dementia and just needed a little bit of support to remember the things that they needed to do on a daily basis. And they came out with this product, which is called Easy Daisies My Day. And you can see the tree is still there. Let me stand back a little bit. The tree is still there, and it has different magnetic labels. So on this side of the tree, on the to-do list, medications, make breakfast, have a shower or a bath, get dressed, phone somebody, exercise. And on the done list, we've got brush teeth, make bed. So on this side, once your aging senior has taken their medication, they move it over to here. And they don't need to remember whether or not they've done it. They can look on this board and see that indeed they have done it. The reverse side of this board is French. And it comes with a lot of tools to make this a little easier for you. There are a series of pre-printed labels with other kinds of tasks on it. And you see these little, these are time frames so that you can put your own time in there and tell somebody when you want them to do that particular task, if that matters. So medications, for instance, you might take medications 4 times a day. So you might need 4 of the medication magnets. Well, they've got that solved too, because they give you a bunch of blank ones. So you can put a sticker over top of here, or you can write your own chore or task there. Again, there are French labels in this package. It comes with a dry erase marker so that you can write your own labels out. And it all comes in a nice little pouch. You can put your magnets in there so they don't get lost. I think that is a very cool product. Now, it retails for $24.99. That is really affordable. $24.99. And it is available at our retail partner, brownhealthcare.com. Down there, you can go online and you can see it, learn a little bit more about it if you like, and you can purchase it online there as well. But think, Mother's Day is coming up, and maybe mom doesn't need another sweater, and Father's Day, maybe dad doesn't need another tie. Maybe they need something to support their continued independence. And I think that this is just the ticket. So Easy Daisies My Day. There you go. Okay, so let's talk about this week News for the oldish. I've only got one item for you because it's a really big one, and it has to do with Pharmacare. Ontario's Minister of Health, Eric Hoskins, resigned his post as Minister of Health and as an MPP in Ontario the other day. And come to find out, he has been appointed to head up Canada's federal strategy on Pharmacare. I think it's a really good appointment, actually, because he was a pretty decent health minister, in my opinion. So, Medicare. Why was Pharmacare not included in Medicare is probably a good question to understand, to know why we're in the predicament that we're in now. So I did a bit of research for all of us. Back in the 50s, when Medicare was being put together, people were looked after in hospitals. So, I mean, they are now too, but they were looked after for the duration of their illness in hospital. So their hospital stay, their medications, everything was included in their Medicare. That's not the way we give care today. Many seniors are aging in place in their communities, and while they may go to the hospital to be diagnosed and stabilized, once that happens, they're sent home with their medications to continue their treatment. So we've got about 1/3 of aging seniors living in the community with one or more chronic condition or disease that is managed by, you guessed it, pharmaceuticals. And some of those pharmaceuticals are really, really expensive. So the conversation has been going on for a long time about bringing Pharmacare to Canada because our systems just simply have not caught up with the times. And with more and more aging seniors coming into a point in their lives where they need this kind of care, but can't afford this kind of care, the idea of Pharmacare has certainly reached a point where it absolutely needs to be considered. So Eric Hoskins has been tasked with this. So what would a national Pharmacare strategy be? Well, it would certainly include the development of what is called a formulary. So a formulary is a list of approved medications. They would be based on best medical evidence, I'm sure. But in my perfect world, the choice of these medications would be completely and utterly free of political and industry influence. Do you hear what I said? Free of industry influence. The pharma industry all around the world is very powerful. They make a lot of money and they don't want to lose that money. But in a Pharmacare situation, when a formulary is developed, somebody would be tasked with negotiating the best possible deals for every single drug that's included in that formulary. And then that formulary would guide doctors and patients to choose their medications. Okay? In our opinion, my opinion, this strategy needs to include tools for doctors, facilities, and individuals who are the end users to prevent overprescribing, to prevent unnecessary drugs from being prescribed, to prevent drugs being prescribed that are without clear medical need. So think a couple of weeks ago on our show, we talked about studies that were showing that in nursing homes, patients were being given drugs to sedate them, not because the patients needed the drugs, but because the staff wanted the patients to have the drugs so that they would be quieter and calmer and more easily managed. So that has to stop. We don't want that going on. We want this strategy to keep an eye on drugs that are addictive, and we want regular review of these drugs to take place. We want to look for interactions. We want the review to include not only prescriptions, but over-the-counter drugs and anything else that interacts with these drugs. The formulary also needs to include man-made drugs together with natural medicines. Now remember, Canada has approved a cannabis medicine strategy. And while it's still being worked out, Big Pharma doesn't yet have its paws on this. There are a lot of players in the game and there's a lot to be sorted out, but a man-made medicine is something that needs to be included in this formulary as best practice evidence comes along. There also needs to be a process for people who are outside of the norm, whose conditions and diseases require that they have other kinds of drugs that may not be on our formulary, but may have been included in the formularies of other countries. So, we hear from time to time about a Canadian who has to go outside of the country to receive a life-saving drug. We are not of the opinion that a Canadian should have to sell their home and go through their life savings to choose between having that or having a life-saving treatment. So the formulary and the strategy needs to not be black and white, but needs to have some room for compassion. We wish Eric Hoskins all the best in developing this Pharmacare strategy because it will not be an easy task. And I've already tweeted him and offered to help. So we'll see if he responds. Do you think Eric Hoskins will respond to me? But I'm happy to help. Anyway, moving forward, let's look at what is coming up on the Oldish. We have a show next week planned because I'm feeling kind of springy and the snow is going away and people are coming out of their houses from their winter hibernation a little bit more. Older people will be out and moving around a little bit. So not that falls don't happen inside the home. In fact, they do. But I think we tend to be more mindful about fall and injury prevention when we're also outside. So we're going to take a look at hip protectors, non-skid socks, and a bunch of other fall and injury prevention strategies. It's kind of right up my alley. It's where I've been working for 20 years. I'm also in discussions, as I have been telling you for a couple of weeks now, with Constable Jamie Stanley of the OPP about finding a date that suits his calendar to come and talk to our Oldish listeners about scams, particularly those that impact seniors. And I was talking just yesterday with our favorite veterinarian, Dr. Ellen Shapiro, and she's going to look at her calendar and find a date that works. We do these shows Wednesdays at noon, and although she is not scheduling appointments on Wednesday afternoons, a lot depends on conferences and other emergency types of cases that she has. So she's going to come and talk to us about aging seniors and their pets, and also aging pets. So there we go. Until next week then, I will wish you adieu and hope that you take care of one another. Enjoy the sunshine. We're going to get that snow on Thursday here in Ontario anyway, but then it's going to go away. I think we're going to have some above freezing temperatures. I think the worst of the winter is behind us, but we probably will still get a storm or two. They're getting a lot of snow out on the West Coast. I'm sorry. They're getting a lot of snow in Italy. I'm sorry. And in other parts of Europe. Spring is on the horizon. So do take care of one another. And remember, as always, that it does take a village to raise a senior. Bye.